Well, good evening and welcome to the COVID-19 pandemic update. I am Kayode Okikulu. First, the highlights. The Lagos government set to begin administering the second dose of the Oxford AstraZeneca vaccine for those who already received their first, exercise to commence in 3 weeks. Taraba State receives solar-powered boreholes and personal protective equipment from the Victim Support Fund to help the fight against COVID-19. Most adults under 40 in the UK will not be getting the Oxford AstraZeneca vaccine due to a link with rare blood clots. We'll begin this evening by taking a look at just how far we have come since February the 27th, 2020. That's when Nigeria recorded its index COVID-19 case. The tension then was palpable, mainly because it was a novel coronavirus that the world knew next to nothing about. But here we are exactly 1 year, 2 months and 10 days after. Well, we still don't know everything, and clearly the battle rages on. As it has been said time and again, we must not drop our guards because we've come too far to lose this now. Well, let's take a look at the latest figures released by the NCDC.
New figures coming from the NCDC said Nigeria has recorded 28 new cases of COVID-19 from 5 states and the Federal Capital Territory. Lagos recorded 10, Rivers 7 and Akwa Ibom 6, while Delta and the FCT recorded 2 each. Kaduna had the least with 1 case. According to the agency, the latest figure includes data obtained from Akwa Ibom over the last 2 days and data from Delta State on May the 5th. The new figure raises the number of confirmed cases to 165,301. 21 people have been discharged after testing negative for the coronavirus, bringing the number of recoveries to 155,424. There has been no death in the last 24 hours, so the total death toll from COVID-19 is still 2,065. There are currently over 7,000 active cases of COVID-19 in the country, and over 1.9 million samples have been tested. 64.1% of Nigeria's target population have been vaccinated so far, according to the latest update by the National Primary Healthcare Development Agency. This corresponds to almost 1.3 million people. Globally, over 150 million cases of COVID-19 have been recorded, with over 92.3 million recoveries and over 3.2 million deaths.
Well, the race to develop a solid legal framework for Nigeria's response to public health emergencies like COVID-19 is still on at the National Assembly. Well, the Senate held a public hearing for the Public Health Emergency Bill, which is meant to repeal the Quarantine Act of 1926, revised in 2004. At the venue, the Minister of Health, Dr. Sagie Hanire, who was accompanied by the NCDC DG, Dr. Chikwe Hekwazu, pointed out some sections that seem to duplicate the work of the NCDC and vest its powers on another new agency. The chairman of the health committees at the Senate and the House of Reps promised to consider the points raised by the health minister and other stakeholders to develop the proposed act. The journey to this point has been quite eventful. Last year, a similar bill at the House of Representatives, which is the Control of Infectious Diseases Bill, which was also termed the NCDC bill, generated a lot of controversy with the powers it gave the NCDC and certain perceived disregard for the rights of citizens. At that time, even the DG of the NCDC opposed some sections of that bill. And away from the nation's capital, the Victim Support Fund Task Force on COVID-19 has donated solar-powered boreholes and personal protective equipment to 3 schools in 3 senatorial districts of Taraba State. The donations are aimed at improving sanitation and hygiene services in schools and communities across the state to check the spread of COVID-19.
This is Government Commercial Secondary School, Takum, established in 1971. Some of the major eroding factors of this institution are the Tiv Jukun crisis in 1997, windstorm and fire outbreak, making the school become a shadow of its former self. More than 3 decades down the line, help has come their way, courtesy of the Victim Support Fund COVID-19 Task Force team. They are here to donate a solar-powered borehole, and PP is a reciprocation of a similar gesture in Wukari and Adokola local government area of Taraba.
There's an advocacy around the country that people should wash their hands under running water. We've supported 54 secondary schools across 18 different states in all the 6 geopolitical zones of Nigeria with water facilities. We decided to make the biggest, the last commissioning. Takum is an extremely important community to us.
Receiving the donations, the state government explains that the non-pharmaceutical intervention will help in driving home their sensitization against the pandemic. The school management and the surrounding communities are sure of proper protection of the project.
The commissioning of this water project has multi-first benefit. It will no doubt balance economic development and at the same time contribute to the preservation and suitable utilization of resources, to name a few.
In this project will alleviate our soft water. So then move from here to the main road to fetch water, but now we'll fetch our water in the campo. I hope this one will even help the students and the staff in ties.
This intervention draws the curtain on donations by the Victim Support Fund across Nigeria, and its choice of Taraba State is for its chairman, retired General T.Y. Danjuma, who hails from Takum local government area of the state.
Well, in the coming days, most of the states across the country will commence inoculation of those who have already taken the first jab of the Oxford AstraZeneca vaccine. Well, Lagos State is getting ready to commence the second phase of COVID-19 vaccination exercise in 3 weeks on May the 28th. And that's aligned with the 8 to 12-week interval between the first and second doses as required by the manufacturers. Residents are encouraged to check their vaccination cards for their next appointment date to get their vaccine at the same health facility they got their initial dose. Meanwhile, during the first phase of the exercise, the Lagos State government inoculated over 257,000 persons, particularly the frontline health workers. And it's been the same waiting game in Anambra State for the second consignment of the AstraZeneca vaccines. 78,000 doses were received in March 2021, but there is no exact information on when the administration of the second dose will commence. Well, Ekiti State is not left out of the delay, as our correspondent reports that over 26,000 people who have received the first dose are already waiting for the second dose. Well, in Osun State, over 300 health workers were trained by the state government for the vaccination program. The health workers have since vaccinated 61% of the target population across the 332 wards in the state. Well, earlier in the week, Nigeria joined the rest of the world to commemorate the World Hand Hygiene Day with a message that just a few seconds of hand washing can save lives. The Nigeria Center for Disease Control led this advocacy here. And now that the day is over, just how much impact will it have in reducing the rate of COVID-19 infections? Not forgetting the challenges of access to potable water and sanitizers and the rest. Well, Dr. Toshi Okor joins us this evening. She's the Infection Prevention and Control Program Coordinator at the NCDC. She joins us from our Abuja studio. It's great to have you on the program, Doctor. I know it's World Hand Hygiene Day, but shouldn't it be World Hand Hygiene Year? I mean, because this is quite important. So how much really can a day like this achieve, especially for something very vital and continuous?
Yeah, thank you very much for having me. Indeed, it should actually be World Hand Hygiene Century. Every day should really be dedicated to hand hygiene. But you know, one particular day needed to be singled out to make a solid push, a solid coordinated push all over the world to begin to make that strong case for the value of hand hygiene. But every day at work, every health worker is expected to use hand hygiene as a very effective but low-cost intervention to ensure both patient and health worker safety.
Right. Now, that's important. But now that the day is over, what next, really?
We marked it on the 5th of May. So even though the day is over, the work hasn't stopped. And actually for us at the Nigeria Center for Disease Control, it's been an ongoing engagement, an ongoing endeavor. And our mandate, as you know, is to safeguard the health of Nigerians. And part of the ways we are working towards achieving that mandate is through the work we do in our antimicrobial resistance and infection prevention and control program. You know, antimicrobial resistant organisms, that is, those things that antibiotics could take care of in the past, it's beginning to be a big problem all over the world. And then you come and add on to it the problem of COVID-19, you begin to appreciate the scale of the problem. So for us at the Nigeria Center for Disease Control, we realize the very important position that infection prevention and control occupies in the prevention of every infectious diseases, and especially also in the prevention of disease outbreaks. So since 2019, we have actually been working both nationally and at subnational with health facilities all over the country to establish strong systems of infection prevention and control. And one of the key bedrock of those systems is hand hygiene. So what we have done is over the years, we have been building the capacity through the training of health workers all over the country on how to strengthen the ability and the capacity for hand hygiene.
Well, you must have noted some of the challenges faced by people, healthcare workers, in some of these interactions you've had. So what are the major challenges, really? Because, I mean, there will not be any need for a day off for sensitization if hand hygiene, hand washing was not a problem in the first place. So what are those major challenges to ensuring, full coverage, hand hygiene, and the solutions?
Thank you very much, and that is a very good question. The challenge is really, I like to look at it from the individual perspective, then look at it from the tasks that individuals need to do, and then we look at the system issues. First of all, individuals need to understand and have the knowledge of exactly how to perform hand hygiene. So you notice that most people think that in healthcare, that hand hygiene is just something you can do anyhow and how you like. But there's actually a system, a technique, and a duration of time that a health worker needs to take to make the hand safe. And that is why you see in this year's hand hygiene slogan, seconds save lives. Because you need to make your hand safe, at least if you're using alcohol hand rub, you need to use it between 20 to 30 seconds. And if you're washing your hand with soap and water, you need to do it for at least 40 to 60 seconds. So that is the duration. And then there are specific techniques that health workers need to understand. That step-by-step techniques that needs to happen coupled with the time duration. This is what evidence has shown, that when a health worker does it that way, it makes the hand safe. So knowledge on the part of health workers is a problem. Then we do have attitudinal problems. A lot of health workers, because of lack of knowledge, and sometimes also because of the workload and other behavioral challenges, really have the attitude that hand washing or making the hands safe through hand hygiene does not matter. And then we look at the system issues. The water sanitation hygiene infrastructure in our health facilities can also be a challenge. Also issues around funding. Therefore, in addressing hand hygiene, we are just not looking at it from one perspective. We are looking at it from multifaceted viewpoints. While we are getting health workers trained and building their capacity, we're also advocating for policymakers, for managers of health facilities to make the infrastructure available for health workers so that knowledge on the part of health workers, good attitude on the part of health workers will be supported by those system change things that need to happen.
Right. Well, I do hope that by next year, when we commemorate another World Hand Hygiene Day, some of these challenges would have been resolved at the various levels. But we'd like to thank you so much, Dr. Toshi Okor, for sharing your thoughts with us on the program.
Thank you very much.
Australia will resume repatriation flights for some citizens in India after a controversial ban on arrivals from the country ends on May the 15th. Prime Minister Scott Morrison has faced criticism for failing to help citizens trapped in the COVID-ravaged nation. Well, the ban sparked further anger after the government said Australians seeking to fly home could face jail or fines. Well, Mr. Morrison later played down this threat.
The committee decision that was taken yesterday afternoon, where we noted that the biosecurity order and the pause was successfully reducing the caseload and risk regarding arrival of persons from India, that the biosecurity order would remain in place with no change until its intended completion date of May 15, that the repatriation flights, the facilitated commercial flights that we have been running now for a considerable period of time, that assisted some 19,000 and 20,000, in fact, people to return from India already, that they would resume on the 15th of May. I advised that while the pause in direct flights from India would be further reviewed next week, it was likely that the Commonwealth Government would not be resuming direct commercial flights from India, and instead invited the states and territories to participate in receiving additional repatriation flights, facilitated commercial flights, into their states.
Well, there's a bigger debate across the world on a possible vaccine patent waiver. So let's get more on this with DW correspondent Clifford Coonan, who joins us from Berlin. Well, Clifford, US President is clearly in support of vaccine patent waivers so that poorer countries can get more access. But the German government does not seem to be supporting this plan. Why?
Well, the German government is not supporting the plan because it says the protection of intellectual property is a source of innovation and that it must remain so in the future. It believes the main factors in vaccine production are capacity and quality standards and not patents. Angela Merkel insists that the priority is for vaccine-producing countries to lift barriers to exports and address supply chain interruptions. Germany backs the goal of a worldwide supply of COVID-19 vaccines, especially through the COVAX initiative, to ensure that as many people in the world as possible have access to the vaccines. However, regardless of whether this is the case, it doesn't really send out a particularly good message from Germany, and it's likely to make Germany unpopular in the global south. Countries like India and South Africa originally called for the vaccine patent waiver. And the WTO said in April that of 700 million vaccines administered so far around the world, only 0.2% have been in low-income countries. And after we've seen the recent surge in India, the world's second most populous country, this kind of underlines that point. It's also opened up another political rift between the US and Germany because they already disagree on things like an attitude to China.
Well, maybe one might better understand Germany's position because one of the key vaccines was co-developed by a German company, BioNTech, and of course other German vaccines are in the pipeline. But what do those companies think of the plans to waive patents?
BioNTech, which aims to supply up to 3 billion doses together with Pfizer this year, they say the patents aren't the limiting factor for the production or the supply of their vaccine. And BioNTech says that waiving the patents wouldn't increase the global production and supply of vaccine doses in the short and in the middle term. And then another German company, CureVac, which hopes to release trial results on its mRNA vaccine this month, say that patents weren't to blame for supply bottlenecks. So it's probably worth pointing out that another vaccine maker, the US company Moderna, said back in October that it wouldn't enforce patents on its vaccine during the pandemic. It says there's a lack of companies able to rapidly scale up complex manufacturing of a similar vaccine to meet surging global demand. Moderna believes countries around the globe would continue buying its COVID-19 vaccine for years, even if patents on the shots are waived. And they've noted that rivals would face significant hurdles in scaling up manufacturing. So basically, the pharmaceutical companies are saying that filling and capping sterile vials for injection, it's a specialised business, and the great majority of large-scale capacity is already being used for the existing vaccines.
Well, on a wider scale, though, Conan, I wonder what the European Union thinks about this. Will it be supporting the plan?
Well, the response from the European Union to the patent waiver proposal has been cautious. European Commission President Ursula von der Leyen says that the European Union is willing to discuss the proposal, but she didn't endorse it. And von der Leyen has been a staunch opponent of a vaccine waiver in the past. She says the EU is ready to discuss any proposals that address the crisis in an effective and pragmatic manner, but that the focus should instead be on getting more vaccines to countries that needed them by following the EU example and permitting the ample export of doses. She said that Europe is the only democratic country in the world, region in the world, that exports vaccines on a large scale. This is clearly a reference to the United States, which is a major vaccine producer, but which so far keeps most of the jabs produced domestically for use at home. So even though Germany has signalled its opposition, French President Emmanuel Macron backs the idea of a waiver of IP rights, although he said that bottlenecks were not down to price or the patents, but rather a lack of platforms to make the vaccines. And Spain indicated support for the US proposal, but they also said more needed to be done to provide vaccines for developing countries. So it's likely to turn into a tricky debate within the EU itself.
Oh, that's right. Thank you very much, Clifford, for that update. Now, speaking of vaccines, the World Health Organization has granted emergency approval for the COVID vaccine made by Chinese firm Sinopharm. It is the first vaccine developed by a non-Western country to get WHO backing. China has already vaccinated millions of people at home and in 45 other countries. But UK regulators say under 40s elsewhere will be offered an alternative to the AstraZeneca vaccine due to a link with rare blood clots. Well, here's more on this and other developments on our COVID-19 Global Update.
In the UK, most adults under the age of 40 will be given an alternative to the Oxford AstraZeneca vaccine due to a link with rare blood clots.
Building on our previous advice related to those aged 30 years and under, we now advise that unvaccinated adults aged 30 to 39 years who do not have an underlying health condition that puts them at higher risk of severe COVID-19 should be preferentially offered an alternative to the AstraZeneca vaccine where this is possible and only where no substantial delay in access to vaccination might arise.
The UK's medicines safety regulator says there have been 242 clotting cases and 49 deaths, with 28.5 million doses of the vaccine administered. However, the agency maintains that the benefits of the vaccine continue to outweigh the risks.
I can confirm today that the position of the Medicines and Healthcare Products Regulatory Agency remains unchanged, that the benefits of the AstraZeneca vaccine against COVID-19, with the associated risks of hospitalisation and death, continue to outweigh the risks of the vaccine for the vast majority of people. There is therefore no change to the approval. The balance of benefits and risks of the vaccine is very favourable for older age groups, but it is more finely balanced for younger people.
Meanwhile, Germany has recorded 18,485 more cases of the virus as the country loosens restrictions on the AstraZeneca vaccine for adults. Data shows the 7-day incidence rate continues to drop, now at 125.7 cases per 100,000 people per week. Health Minister Jens Spahn says the third wave of the coronavirus pandemic appears to be broken as social distancing measures and an accelerating vaccination campaign help lower the infection rate. In other developments, Japan has extended the state of emergency in Tokyo and 3 other areas until May 31st, weeks before the Tokyo Olympics. The 3-week extension of restrictions has been attributed to the 4th wave of the virus as Tokyo and Osaka continue to record infections. The extension from May 11 to May 31st leaves a margin of less than 2 months before the game starts in July 23rd. And finally, Nepal reported a new record high of 9,070 COVID-19 cases in 24 hours on Thursday as the country battles a surge of infections. Additionally, another 54 people were confirmed to have died of the disease in the same period, marking the third day in a row when daily death toll exceeded 50.
Well, don't forget to protect yourself. The virus is still out there. So continue to take responsibility, and don't forget to visit our website, channelstv.com, for more updates and better understanding of the pandemic. We also have all the big stories from politics to business, sports, and so much more, all at your fingertips. Well, that's the COVID-19 update. Thank you for watching. I'm Kayode Okikulu.